If a ligament on the outer surface of the elbow is damaged, it may need surgical repair. 1 or 2 incisions are made on the skin. A portion of a tendon is removed and prepared for use as a tendon graft. Not all of the tendon is removed, so it will still continue to function. Holes are drilled into the bones of the elbow, and the tendon is docked into these and secured, replacing the damaged ligament. The skin is then closed with sutures or skin staples. The contents of this video are a general depiction of this procedure and the risks involved. It's not necessarily accurate for your personal situation. Information specific to your individual circumstances is listed in the written consent information sent to you by your healthcare team. Thank you for listening. Please watch this again to ensure you've understood everything.